The most common clinical manifestation of a pinworm infection is an itchy anal region. When the infection is heavy, there can be a secondary bacterial infection due to the irritation and scratching of the anal area. Often the patient will complain of teeth grinding, and insomnia due to disturbed sleep, or even abdominal pain or appendicitis. Infection of the female genital tract has been well reported. Diagnosis: a person infected with pinworm is often asymptomatic, but itching around the anus is a common symptom. Diagnosis of pinworm can be reached from 3 simple techniques. 1. The first option is to look for the worms in the perianal region 2 to 3 hours after the infected person is asleep. 2. The second option is to touch the perianal skin with transparent tape to collect possible pinworm eggs around the anus first thing in the morning. If a person is infected, the eggs on the tape will be visible under a microscope. The tape method should be conducted on 3 consecutive mornings right after the infected person wakes up and before he/she does any washing. 3. Since anal itching is a common symptom of pinworm, the third option for diagnosis is analyzing samples from under fingernails under a microscope. An infected person who has scratched the anal area may have picked up some pinworm eggs under the nails that could be used for diagnosis. The medications used for the treatment of pinworm are either mebendazole, pyrantel, or albendazole. Any of these drugs are given in 1 dose initially, and then another single dose of the same drug 2 weeks later. Pyrantel is available without prescription. The medication does not reliably kill pinworm eggs. Therefore, the second dose is to prevent reinfection by adult worms that hatch from any eggs not killed by the first treatment. Health practitioners and parents should weigh the health risks and benefits of these drugs for patients under 2 years of age. Repeated infections should be treated by the same method as the first infection. In households where more than one member is infected or where repeated, symptomatic infections occur, it is recommended that all household members be treated at the same time. In institutions, mass and simultaneous treatment, repeated in 2 weeks, can be effective.